Really seeing him. Hi, Summer.
Hello, I'm sorry I'm late.
No, no, not at all, sir. We are still, I mean, before the time, we have still another 5, 7 minutes. And also, I think maybe Dr. Khushbu has joined. So we were, Dr. Summer, we were just taking advantage of this pre-time to even get some meaningful questions answered. And Kalpana had mentioned about another colleague, Harshit, who had a question pertaining to child and baby. So Kalpana, can you please, Harshit?
Harshit को Abhinav unmute Harshit so he can ask. Hi Harshit. Yeah, he just joined in, no?
Sure. So, you know, this way we can...
He has a 2-month-old kid, no? 2-month-old, I think so.
Robin, you already did introductions?
No, not yet, not yet. That's what I'm saying. Right now, it's the pre-start. But since we are here, I mean, it's informal. No. We can get to know each other. I mean, right now, in fact, that's the idea. While we are waiting for others to join, so we've not started yet. Yes, yes. We are just hanging out in the green room, having a coffee.
Abhinav, can you unmute? Dilpreet, can you unmute Harshit? So then, Dilpreet, hi.
Yeah, hi. He's been unmuted, Harshit.
No, but he's still on mute.
I think he might be like waiting for the 9 o'clock to start.
No, but I told him to have. Because no.
And also we have with us Dr. Samar and Khushbu would remember, of course, Ajay Goyal, the alumni president of our association. Hi, Ajay. You're on mute, sir.
Hi, how are you?
Hi, Robin. Good evening.
Great.
Good seeing you again for a good cause.
We all are in it. I mean, I think everyone.
Absolutely. Goes without saying.
You know, the underlying theme of this series, I was thinking is perhaps, you know, like live and let live and do seva.
Absolutely.
Right. I mean, we all have to live. Live means take care of our health, live ourselves, and then let others live also, between man and nature, man and man, etc. and with seva. So I think with that philosophy, everyone here is joining. And we have Dilpreet, who's been working very hard to make this gathering a good one. Of course, Kalpana.
Special thanks to Dilpreet and Kalpana for sure.
Thank you so much. Sir, hi, Ajay sir, how are you?
I'm good. You tell me.
Very fine, sir. Very fine with your blessings.
No, excellent work being done. And I truly appreciate that. Wonderful.
In fact, I just want to mention, because there are 2 of my friends, one is from DPS. They have joined in. They said we'll be silent observer because they want to, you know, do a similar kind. So that's why I want to request Robin if we could get it done for the, you know, for the parents as well as for the teachers and the children, maybe class 11th or 12th. So the next time when you have that. And then there is also one more person, Dr. What is her name? Meenakshi. She's a principal of a school in Almora. She, I think, has joined. So she would like to see what exactly it is. So we were thinking if we could have it there, because Almora, these small towns, especially in Uttarakhand, they are facing a lot of cases and do not have, you know, doctors to actually guide them there. So, and it's very difficult. So if we could do something similar there, that would be so good. And we were also discussing in Garhwal also the other day, a few of my friends said that they have, you know, even somewhere in Pauri or Chamoli, remote areas. So that could be very good. So if you could split, because now this, you know, more than the cities has gone to the villages where, you know, access to medical facility is not there. So if you could reach out there, that could be really doing something really good.
Yeah, I think that, you know, at least the physicians that are on this group, I think would be very happy to help whoever we can. I think our goal to come on this thing, even I told Robin before this, and I think the group that's here right now, some of them were there in our prior presentation. And, you know, I think that it was just, we're here to sort of support the medical and the patient community. You know, we had this happen here and we'd be happy to help whoever we can to the best of our, you know, abilities. But just to kind of make sure that everyone understands that we are doing this for information, and again, going to the physicians on ground is extremely important. But we can definitely kind of help them identify when they should definitely go, just sort of whatever questions they had, point them in the right direction, clarify, and just honestly be there and tell them that, hey, we're here to support you guys, and that's what our role is. And we had that help, which really made us feel that we had someone backing us up, and we want to do the same thing to our colleagues and our patients and our families in India.
Thank you so much. May I request Khushbu, your sound has a little bit of, if not an echo or something like that, if you could please, or maybe I am.
She is on mute.
I think. Are you able to hear me now?
Yeah, much better, perhaps. At
Okay.
least.
Sorry, I think I was probably pushed back a little bit more, so you couldn't hear me.
Yeah, sure. Thank you. So, I mean, it's the time to start, but let's say we wait a couple of 2 more minutes and we start at 11:35, 9:05, right?
Okay. So we time another 2-3 minutes.
Yes.
Who else wanted to? If anybody has any queries before, they can always ask. And I request all those who have been silent, if they, especially a few people I have called who really, want this town hall to take place in their area. So if they want to ask anything, please feel free to ask.
I have one request.
Yeah, Anand. Yes.
Yeah, I would like to record this session if possible.
It's being recorded, sir, and you will get it tomorrow morning. You will get it. We are
Wonderful.
recording it
On the cloud.
On the cloud. Abhinav will tell better. Dilpreet, it's on the cloud. I'm not very sure.
We'll do that on YouTube.
So we'll put on YouTube and share the link.
I have a question before you start.
Okay. Indeed, Arora. Start.
Yeah, I just wanted to know, since this anxiety about COVID in children is slowly gaining ground everywhere, what are the preventive measures that our doctors see so that parents and so-called educational administrators can put in place?
What I'll suggest, Randhir, that this is a very important question and should be answered when most of the people have joined, because it's for everybody's benefit. This is one question which needs to be answered to everybody. So we can come back to this question because this is something I want everybody to listen to.
Okay, no issues.
We'll wait for 2-3 more minutes. Harshit wanted to ask a question, but suddenly I can't. He's on silent. He is logged out.
No, I think he's yet to come back because he's on mute himself.
With us? Is Dr. Samar already with us?
Yes.
Yeah.
Dr. Avika is also there.
And we have one Ajay, Dr. Geeta she's a pediatrician. She has joined from Boston, you said, Geeta? Dr. Geeta.
Dr. Avika was actually...
I'm so sorry, Dr. Preeti has joined then.
In fact, we should thank Dr. Preeti because it was a last minute request of, I think, Dr. Samar and Khushbu. Dr. Avika Dikshit was supposed to join today, but her husband apparently has fever and a baby, and so she's really, involved with home. So
obviously, understandably so.
Dr. Preeti. And even she had some, I think, some affairs, but she's managed to kind of join us. Thank you so much. Yes.
Okay. So in the meantime, I could just, for general awareness, I could ask Dr. Khushbu that have they also been facing this black fungus kind of thing in US the way we have been facing it in India, or is it a India-specific phenomena?
Yeah, we had not seen a lot of mucormycosis in the United States as much. The case that we did have was more of a candidemia, which is a little bit different than mucormycosis. Of course, Samar and Preeti can pitch in as well, but we have not seen that here in the United States. I think it is more so in India at this time. And, we can definitely delve into things that we think might be the cause or the reason why this is happening there over in the United States. Some of the things that we had mentioned, that Samar and I had discussed were probably the steroids. Remember, we had discussed this last time as well. I think the use of steroids is very liberal at some points in India. And I don't think that, I don't think that it is that the physicians are prescribing and over-prescribing or that. I think it's more that when one person hears about steroids and the effects and the benefits of it, everyone thinks that we should go ahead and get it. And I think it's sometimes being used in cases where it should not be used. And so that's one thing. The second thing is that, the actual mucor, the fungus that we are talking about, it's everywhere. And it's usually present, it doesn't cause a disease in patients who are immunocompetent, meaning that the patients who are not suffering from any kind of illnesses per se. And COVID can causes immunoincompetence, meaning COVID can affect patients that decrease their immunities. So that's one reason why that may be happening. You see it more so, again, in tropical areas, which is another reason why India may be a country where we're seeing this. And then also, I think that maybe there's some things that we are not doing correctly, maybe cleaning of the concentrators, of the oxygen, the humidifiers, using still water instead. Well, we should be using still water, but using tap water, just because, people don't have information. We were just trying to rush in all different things from everywhere just to help patients. So I don't think that it was, as much that there's a, that it's a fault per se, but I think it is more that it happened just because we were rushing to do things, and just because, we found out that this medication helps and we all just are rushing into taking that medication. I think what we should do now is to sort of, pull back and reassess when it needs to be given, really truly follow it with guidelines and do it under the care of physicians that are in India and just outside, and really get the information about how we should be cleaning our oxygen supplies in the hospital, outside the hospital, and just, understand that patients who have diabetes, understand that COVID in itself causes your immune system to go down. So all of these things need to be kept in mind when we move forward. And I'm sure that Samar and Preeti can add on to that as well.
May I request, thank you so much, Dr. Khushbu, and before Dr. Samar starts, I think we can start, quote unquote, the proceedings, because this will keep on rolling beautifully then. So may I request my colleague, Kalpana Pandey, the Delhi chapter president of the St. Joseph Alumni Association, to begin, please.
Good morning, good evening, and good morning to those from the US. Good morning. So I'm Kalpana Pandey, as Robinda just said. So on behalf of St. Joseph's Alumni Association Delhi chapter, it's a great privilege to welcome these three eminent doctors. And for this, for this session, which is called a CovidCare Town Hall, where it's going to be an interactive session by these three eminent doctors, where you can, any queries that you have, whatever you want to ask, you can ask them. Plus, they'll be telling us something about this COVID. I don't have to talk much about it because everybody knows this, the way this thing has affected us, our life, our lifestyle. So many things, the whole world has changed. I don't know what is the world going to be post-COVID. I don't know, but everything has changed. So many things have changed. So we have so many anxieties are there, so many queries are there. So this is, an attempt to solve this. And we are so fortunate that we have these such lovely doctors who have been going out of the way to help. And obviously I have to thank Robin for that, because he's the one who's organizing this for us. So first of all, I would like to welcome the three eminent doctors. We have Dr. Khushbu Choksi, Dr. Preeti Malhotra, and Dr. Samar Mehta. So great that you people have joined in. A warm welcome to each one of you. And now, we recently, the SJ Alumni Association, our parent organizations from Dehradun, we had organized this and it was very informative. And there were so many people were really, they in fact, they've been requesting us to have more of that. And that is what the endeavor is now going to be. After this, let us, approach more and more people and try to help more and more people. And with your help, all the doctors there, you are there, and Robin's help, definitely we can make a little difference in the lives. So now over to you, Robin. Thank you.
Thank you so much, Kalpana. And A warm welcome to everybody on this in this session. I'll not take much time. I'll just read out a few basic guidelines, which we hope will make the session as productive as we can, given the limited or whatever time. Firstly, some basic house rules. Yes, please keep yourself on mute to avoid audio disturbances. Please ask any questions in the audiences in the chat box on the side, and we'll read them up on the chat and then invite you to ask your question, right? And please do keep your questions short and focused. If some questions cannot be answered today, you can email it to Kalpana or Dilpreet, our other colleague whom I'll introduce soon. And those email questions would be passed on to our doctor colleagues, and we are requesting them to maybe give written replies to those questions. So don't worry if your questions cannot come in or you have an incomplete answer you think. We have received several questions in advance. We'll pick them up as we go along. Our colleague, as I mentioned, Kalpana Pandey will assist me, will help me, will be with me to moderate this. Of course, our colleague also Dilpreet, who is an entrepreneur in his own right, and he is the secretary for the Delhi chapter of our Alumni Association. The discussion format will be opening comments by the doctors each, 3 of them, 3 to 4 minutes each, which will then be followed by an open house Q&A session. Please keep your questions focused as I've requested. Now may I request our doctors for their opening rounds. Dr. Khushbu, you have 2 or 3 minutes, 4 minutes, overall topic today, but perhaps you could look at, regarding COVID, what are you most worried about? And what are your 2, 3 common sense suggestions to anybody who is like, let's say right now, a caregiver to a COVID mild, moderate patient? Or you can, with any prism you would like to share.
Thank you, Robin, for allowing me to join. And I want to welcome everyone that's on this panel and everyone that's joined us today. I think it's a very good question. And I think something that a lot of people have asked us, and probably are wondering as well. I think the single most thing that a person can do if you are taking care of your family member is to protect yourself first. Okay, I think that wearing the mask, distancing yourself, being aware of avoiding the secretions from your family members so that you don't become the vector or the vehicle to spread it further. Make sure that if you're in your home, your family member who has COVID and you as well, if you have N95s, you can wear them or just double mask. If you are using gloves, make sure that once you give them the things that they need, that you unglove and you wash your hands. And you at least want to wash it for 20 to 40 seconds and just clean. Soap and water is very good. Make sure you guys are cleaning areas that are used very frequently, like doorknobs, for example, or bathrooms. If you have a bathroom that you can dedicate to your family member, that's great. If not, just keep it clean. Laundry, clothes, all of these things need to be washed immediately. You can, of course, clean all the utensils, wash them with soap and water. Gloves are recommended, but if you don't have that, it's okay. You can just wash your hands as well. So I think little things like that, people staying away from family members who have COVID, just keeping them in a room if you can. I think those little things go a very long way. And most importantly, getting vaccinated. I think that is one key message that we're all trying to give everyone. Please get vaccinated. I think that I know that Summer and I'm sure Preeti will give you a lot of information about that as well. I think that is something very, very important that we can do towards our community to prevent or to at least slow down this disease, which is what we have done in the United States, and it seems to have been working. And that's what I would say. I would kind of join to Preeti and to Summer. I'll mute myself now, Robin.
Thank you so much, Dr. Khushbu. May I now invite Dr. Summer Mehta for his opening thoughts, comments, and perhaps you read a question also on the side chat, Dr. Mehta. If you can, quickly, without maybe spending more time on it, but in a general sense, it could refer to that if you've seen the question I see. But otherwise, your thoughts similarly again. What is your biggest worry right now? And what would be some treatment or non-treatment you would advise to somebody? Right now, I'm saying mild, moderate, stages of COVID.
Thank you, Ravinderji, and thank you everybody for inviting us back. I think I met many of you last time. My name is Dr. Samar Mehta. I'm an infectious disease and emergency doctor in Boston, US. So I obviously, like, just to answer your questions, I think Khushbu already said most of the things that that I was going to say as far as prevention. The main thing I would say, which I think all of us are thinking that, or many of us are thinking that the one thing that I'm most worried about, like these pandemics, they're like fires, that there's a spark and it burns through a population. And we've seen how bad the situation was in the metros in the past few weeks, although thankfully the numbers look like they're at least leveling out a little bit in new cases, if not, although deaths are continuing. I think a lot of us are really worried about the rural areas. Again, like I think as has already been said, that if it's hard to get oxygen in Delhi, imagine what happens when the nearest hospital or the nearest clinic or the nearest doctor is 30 kilometers away. And so that's obviously I think what we're all concerned about is that a very big country, and we're still worried about the population that's outside of the metros that might take more before COVID reaches there, but might be harder to deal with. As I think the people on this call mainly know, that fortunately or unfortunately, most cases of COVID tend to be quite mild, and even in those cases that are serious, there are very few medical things we can do. Of course, we can provide oxygen, we can provide supportive care. There's a question about steroids. We can provide some steroids. There's a few medicines, but really the best cure here is prevention. And again, just to echo exactly what Kush said, is like, it's those basics you have under your own control of masking, try to, as much as possible, keep your breathing and respiratory secretions away from others. Very good hygiene about washing your hands when you come in from outside, trying to keep as much as possible people who are sick separate from other family members. And of course, although it's challenging with logistics, but vaccination, I think we're all hoping will be the ultimate solution. So, if it becomes available, I would encourage people to get vaccinated. So I think those are my concerns and my strongest recommendations. Of course, we can talk about black fungus and white fungus and all kinds of other things as well. And we should definitely, Robinderji, if you don't mind, we should specifically introduce Preeti, because I think the first time we've had someone who's really a pediatric expert on infectious disease and infection control. So this is someone who I think will have a lot of valuable advice that's different from when Kush and I said last time. And the reason I mentioned that is the last thing I would say to add to what Kush said, in addition to hygiene, protecting yourself, vaccination prevention, the other thing, which you're all already doing, is just stay informed. There's so much, not only in India, but all around the world. There's so much information. Every day my parents call me and they say, oh, they told me that, I should worry about white fungus or I should worry about this. Be aware that a lot of that information that you hear, you should just at least try to learn more about it. Ask people who do it for a living. Be cautious, but don't be panicked about everything you read, because the anxiety can be terrible, and it's important to stay informed so you understand what things really we should focus on and not spread our efforts in too many, down too many directions that are less important.
Thank you so much, Dr. Samar. Very brilliant points, and some basic reminders that there is only so much what doctors can do, as it seems your message is. But at the same time, whatever we've learned, try to confirm to that and seek out more. Thank you so much. Now, may I invite Dr. Preeti Mehrotra, of course, from a children perspective, but also as I'm seeing the chat coming in. So, Dr. Preeti, you could also, take, what are your 2-3 common sense, strongest recommendations or thoughts on this. But I see a question on chat also from Anand Mittal, which you could perhaps quickly look at. It was in the grapevine that pregnant women should not get vaccinated. Is that true? So that's a footnote of a question that, we can quickly answer also. So Dr. Mehrotra, please.
Sure, thanks so much for having me again. I'd say a couple points and they largely will echo Samar and Khushbu's points. The first is prevention is the best measure, and the most effective prevention measure is vaccination. Followed after that, for both adults and children, specifically children over 2 years of age, is masking. So that includes masking, particularly in outdoor settings and in school settings where children might be in larger crowds. What has made this pandemic, I think, so incredibly challenging is that unlike other illnesses, there is a part of the disease where we transmit the most when individuals may not be symptomatic at all. And so that is why masking is probably the most effective prevention measure after vaccination. What I would say to the question in the chat about pregnant women is that pregnant women should absolutely get vaccinated. And there is data now to show that there is protection that is offered to the baby from mom when mom is vaccinated. So I fully support it. And there should be no difficulty or no hesitation for a mom to nurse her baby when she has received vaccination. I might also add that even for moms who have COVID disease, it is safe for moms to nurse their children. In those settings, it may be helpful for mom to mask if possible when she's nursing, but there is no contraindication. There's no reason to not nurse one's infant. I'll pause there.
Sure. Thank you so much, Dr. Preeti. And now, once the opening thoughts and remarks are done, now we'll kind of dive into the Q&A as we were slightly, kind of delving into. Before I go into that, there's a question, a follow-up on this quickly, maybe if I can take from the chat itself. Anand, Yogita Arora is saying that, no, before Yogita, that I find that hard to believe. Can we have a second opinion, please? So would Samar, Dr. Samar and Dr. Khushbu chime in on what Dr. Preeti's thoughts are?
You can have a second and a third and a fourth opinion. Most of this is recent from the U.S. Setting. So I've not heard specific Indian recommendations, but I completely 100% agree. We were cautious in the beginning, but everything what Preeti just said, Dr. Mehrotra said, that US CDC, the American College of Obstetricians and Gynecology, all of the people who focus on recommendations in the US for pregnant women have come out saying it is safe and actually desirable to vaccinate pregnant women.
Great. Thank you so much, Dr. Samar Mehta. Dr. Khushbu, would you want to add to it? Just for
I think, yeah, sure. What I would say is I respect Dr. Preeti's and Dr. Samar Mehta's opinions. They're both very well known in their own fields of infectious disease. And fortunately, even I have been able to read this, and this is some of the newest guidelines that have come out, again on the US side, and I definitely echo what both of them just said.
Awesome. Thank you so much. So at least, it builds up because people are like, there's too much confusion floating around. Thank you so much. Okay, now we move into the interaction portion of the discussion session today. The way this portion will work is that my two colleagues with me, Kalpana Pandey and Dilpreet Grover, they will be, and of course, I'll be looking at the questions which are coming in through chat. But Kalpana, you had some guests who are probably in the town hall right now who had sent us the questions earlier. So if they are present, can you please request them to say their questions? Anybody who's asking a question, kindly, please keep it short and focused. Thank you so much.
First of all, before I start, a big hello to Mr. Bhim Ratke. Mr. Bhim Ratke is from a 1952 batch of Josephites. He's just come back just recovered from COVID. And he says that he himself can give a lot of guidance about it. Hello, sir. Mr. Bhim's iPad. So he's just back from this thing. And one more person I want to, say hello to is Dr. Tushaba Shinde. He is joined from Pune. Tushaba.
Yeah, good evening, ma'am.
Good evening. He is himself a doctor and he's a senior railway officer, and he organizes a lot of these, seminars to help a lot of people. So, that is why I've invited Dr. Tushaba. So you just have a look, and next time let's have it there, especially around Pune area where things are not very good, especially the village areas there. So welcome, Dr. Tushaba. And now for the questions. So, before there is one question, I don't know whether that lady is present or not, but in fact, what Dr. Preeti was just said, she solved most of her problems, but she was asking whether a mother can, nurse a mother can nurse if she is suffering from COVID. And there was this one more question for which Harshit, I think is not. Harshit, are you there? You want to ask this question or should I ask it for you?
I'm pretty much here, ma'am, but you can ask the questions.
Please
Okay.
ask the question. No, you please ask the question from Dr. Preeti regarding your.
Okay. Okay, I'll do that right now, ma'am. So, ma'am, this is regarding my baby who's 2 months old, and he got the infection for COVID, and he tested positive. Though there was not a major problem, wherein he had a temperature of about 100 for 3 odd days. After that, the temperature went away. He was given basic paracetamol, azithromycin, and some multivitamin. But with the baby, you don't really get to understand the symptoms now after 15 days when probably the virus is over. So first of all, that after having a baby COVID positive, in the time like a 1 month or a post-COVID recovery, wherein a lot of complications are happening with adults, what are something that you have seen with the baby which we can probably look for as signs? Number one, his 2nd month vaccination, which was due somewhere around where he got COVID, I think, which are given at the 2nd month after the first vaccination. There's a gap of about a month or a month and a half. That was postponed to the 3rd month. So in the long run, will that affect the baby's growth as such?
Thanks for all that question. I'm happy to hear that your 2-month-old is doing well. And that is the case for what we've seen for most children, in particular children who are very young, children under 1 year. So as you described, the way COVID usually manifests in children, and in particular young children, is usually just with some fever, perhaps some difficulty nursing or feeding, just like with many other viruses. And very fortunately, there has not been severe disease in children, and in particular young children. By the same token, there has not been much that we've seen in the way of post-COVID symptoms or post-COVID difficulty with children. There is a very rare entity called multi-inflammatory system condition in children, which is extraordinarily rare. I would say that the true incidence of it is not actually known even in the US, because it's been so hard to identify what that constellation of illness can look like. But usually when we have seen it, about 4 to 6 weeks after initial disease, MIS-C, as it's called, MIS-C, can present with fever and lethargy, difficulty feeding. And the reason why you want to address that early is because it's the body's sort of having its own inflammatory response to the original infection. And so it can affect other organs in the body, the ones that we worry about the most being the heart. And so it is an incredibly rare entity, but something that we are now keeping a much closer eye on in the US. And as we see more cases in children, trying to surveil and look for this entity called MIS-C. With regards to your second question about vaccination, we always recommend that no vaccines should be given at the time of active infection. So when baby actively has a fever or is feeling unwell. But as soon as that passes, it's perfectly appropriate to give vaccination. And so it was appropriate for your 2-month-old, now 3-month-old, to hopefully get those shots. And there should be no delay in giving those shots, as those are equally effective and helpful and necessary in preventing other diseases that we worry about.
Thank you so much, Dr. Mehrotra. Thank you, Harshit. Before I invite Dilpreet to kind of identify some of the questions and our guests, I was reading in the chat, there's a question coming which has already been answered, but perhaps the gentleman was not there. Kapil Behel is saying, can a feeding mother get herself vaccinated? My understanding, as I'm getting from here, is that yes, she can get vaccinated, right, Dr. Mehrotra?
Absolutely correct.
Fair
yes.
enough. Thank you so much. So that answers your question, Mr. Kapil Behel. Now, may I invite our colleague Dilpreet, the secretary of the Delhi chapter of the St. Joseph's Association, to kindly identify some of the guests who earlier already sent us the questions and who are already present right now. And if any folks you may want to acknowledge or just give a shout out hello to. Dilpreet, sir.
Right. So before I actually begin on the question that was put across, Yogita Arora had a question, so if she can just put herself on the mute and ask her question that she had. Yogita?
Yeah, good evening, everyone. Ma'am, I just want to ask that what precautions or measures we can take from day one of COVID infection to prevent lungs infection in diabetic persons, especially in diabetic persons, because the condition is becoming very severe in case of the diabetic persons. Thank you, ma'am.
Thank you so much, Yogita ji. May I invite this is between the counselors to decide and which way to. Khushbu, please, doctor.
Do you want to take that? Yeah.
Yeah, I'll start off with that. Thank you, Mr. Gita. That's a great question. I will tell you that, a lot of the COVID infection doesn't translate to being a pneumonia, which is what you are worried about. 80% of the patients who have COVID don't end up having the disease that you're scared of. Okay, so that's one. Now, in diabetics, they're at an increased risk, just as you very well identified. What I would definitely do is, just kind of monitor her or your family members at home. The way you would go about that is to monitor their oxygen levels. Okay, so you would buy a pulse oximeter, which I know you guys have over there, and I've seen a lot of chats with showing them pictures of as such. I would continue to monitor the oxygen levels. If you notice that the oxygen level is dropping below 74%, and by that I mean not just when they're resting in the bed, but also if they're walking, if they are starting to walk. I'm sorry, are you not able to hear me?
Yeah, we can hear you, but there's an echo. There's a slight echo of sorts. It's not very clear as it could be. Maybe, please.
What about now? Is this better?
Yeah, better.
Okay. So tell me what you guys heard last, and then I can go from there.
Sorry?
Tell me what you heard last, and I can go from there if there was something unclear.
I think you can please continue. It was audible, but like waxing and waning. Please continue. It's much better now. Thank you.
Okay, sure. So like I was saying, the importance is to measure your oxygen levels when you are walking as well. So, I think a lot of you guys have heard about something called a 6-minute walk test, where you're walking for 6 minutes and then you're measuring your oxygen. If that level also drops below 94, that needs to alert you that, hey, this disease is going to progress. At that point, if you're a diabetic, I would immediately get in touch with the physician that is there on ground, because you may need to be started on therapies, including steroids. And at that point, the sugar control becomes very important. But to tell you that, all of the patients who are diabetics progress to that would be an incorrect statement. You are at an increased risk for it to progress, but doesn't mean that everyone progresses. Does that answer your question?
Thank you, I think. And Dr. Samar can, add to it, please.
No, I mean, Kush is the lung specialist. Dr. Chokshi is the lung specialist, but I agree. I think, I think half the battle is already, Yogita, that you recognize that diabetes does place people at increased risk. Like Dr. Chokshi said, it doesn't mean that everybody who has diabetes will get terrible disease, but yes, it's something to keep an eye on. So those are the people where, excuse me, where I would be extra careful. The main thing, unfortunately, you can't prevent the virus from going to the lungs necessarily, but to keep an eye. And if you notice the oxygen starting to drop, at that point to try to get to a doctor as soon as possible so you can get direct care. And I think that's just echoing what Kush said.
Dr. Samar, I have a follow-up question on this. So,
just a moment, please. Before,
yes.
On the chat itself, there's a question which maybe Dr. Khushbu can answer, which is quick. Whether steam is effective for COVID prevention as other countries are stressing on it. Dr. Khushbu, your quick answer to it. Whether steam is effective for COVID prevention.
So there's nothing, so steam has not, there are no studies that show that steam is effective or ineffective. If you want to use it, you can, but it has not been shown to be effective from the things that we are aware of in the United States. And someone might be able to answer that as well.
Thank you.
Yeah. I think on the last call we were on, Kush, like somebody was saying, and I agree, like I grew up, my mom gave me steam every week. I think we've all done it. I'm not aware, and Preeti, correct me if I'm wrong, or Kush, but I don't think there's any harm. I would be careful of, some people do neti pot, or like where they will rinse their nose with water, and I would be careful about that. If it's not sterile water and you try to do a rinse with water, that can actually cause more problems, especially in the inflamed tissue. The steam itself, as long as it's mild, not, and done safely and not done on people too young, I don't know that it will help. I don't think it'll hurt.
Thank you. Thank you so much. Great. Yeah, please, Dilpreet.
Okay, so my question was to Dr. Samar regarding the diabetic thing that he was answering. That specifically, we've seen the fatality rate is higher in cases of patients who are already suffering from diabetes, and when they catch COVID versus any normal person. So, what are the steps or what are the things that a diabetic person should keep in mind to prevent themselves from making this infection really very serious?
Yeah, Dilpreet, it's a very, very good question. I think there are two aspects. It's definitely, I think from the beginning, from 1 year ago, from very early, we realized that people with diabetes very often tend to get more severe COVID disease. There are two reasons. One reason is if you have diabetes, if you've had diabetes for a long time, it means there's already quite a bit of damage done in your body. And so you have increased risk of heart attacks, you have increased risk of strokes, your immune system is already weaker than if you didn't have diabetes. The best thing I can say is just be very careful of your sugar. If you have diabetes, take your medications, follow up. But this is a longer term thing. The second issue is even leaving aside the longer term thing, I think that there are some of the medications we use, including steroids, can cause particular problems for diabetics, and you've heard about this fungus. The main, I think, and that fungus usually will happen, like I think Kush was saying, that fungus is very common in the environment. It's everywhere, both the black fungus or mucor or the white fungus or candida that you hear about. Those infections can be even more likely in someone with diabetes who's on steroids. So it's not necessarily by the time you have COVID, if you have diabetes, watching your sugar for the next week is not going to change your long-term plan. But you do have to be very careful of your sugar, especially if you're on steroids, to make sure it doesn't go up and up, because that can increase the risk not only of COVID, but of the complications like fungal infections. So I would say just be careful and try to get advice from a doctor so that you're monitored, especially if you're on those medications, to try to prevent or catch the complications before they get severe.
The other thing I would add to Samar's point, which I think all of us have stressed, is that the best thing to do is to not get it. And so the prevention part is extremely important. If you know you're a diabetic, you need to be a little bit more careful. Your diet needs to change. You need to be wearing masks. You need to observe social distancing. Once you have COVID, I don't think we have identified which we do know the people at risk for advancing, and diabetes falls in that category. But I think prevention in patients who know that they are going to be at an increased risk is what we should be focusing on.
Thank you so much, Dr. Kushbu. Dr. Preeti, would you have something to add to that, please?
I would echo 2 points. The first is that, to Samar's point about the long term, what you can do from a prevention standpoint, not just for COVID, but for health in general, is to manage your blood sugar and to keep track of it, and that includes your your dietary habits as well. Once COVID disease has occurred, and if it is severe enough to Kushbu's point where you might develop a pneumonia and need steroids, then sugar control becomes even more important for the duration of the period that an individual requires steroids, and then even after that, because there might be some lability in what happens to one's sugar.
Thank you so much.
Thank you so much.
I hope it helps out at least to the direction. Now I invite Kalpana again, please. We are getting lots of questions on the chats. So folks, what I'm trying to do is balance the questions which we are reading on the chats, plus balancing the questions which our colleagues Dilpreet and Kalpana have been assimilating with the folks already out here. So Kalpana, would you have some other colleagues who've joined us who have some questions which are known to you?
Yeah, in fact, Randhir was asking a question. Randhir, if you can ask your question now, please. Please unmute, Randhir.
Yeah, I just wanted to know, since there is this lot of fear about COVID among children, what are the precautions? Are there any different precautions that children need to take? Number one, at home, or maybe in public places? And what do you advise to our educational administrators? How do they deal with this? It's a question for Dr. Mehrotra?
It's a great question. It's a very important question. And I think it's a question that the entire globe is struggling with, particularly because it makes very clear how important education and the education settings are and how challenging it is. I would say, as we've mentioned many times now, fortunately, children typically do not develop severe disease. That's not to say that they cannot get it. And so the most important thing I think children can do, particularly in education settings or settings where there are many children or in a crowded classroom, is masking. And that's because vaccination is not available to children at this time. I'm hoping in the very near future that it will be, but masking. And that's how we get back to school and making sure our schools and education settings stay open and provide children with what is equally important to their social and mental health.
Thank you
so much, Dr. Mehrotra. Kalpana, would you have another question from any other colleagues?
Yes, I think Praveen had a very good question to ask. Praveen, please ask. And there is one from Poonam Arora had asked, a friend of mine. I'll ask. Poonam, you're here? So you can ask first. Praveen, first you please ask.
Kalpana, I've already posted the question.
So you please ask.
You can ask on my behalf.
You please go ahead and ask the question.
There are people who have got both the doses of vaccination, but they've lost the battle. Why is it so?
Thank you. Dr. Samar, Dr. Khushbu, Dr. Preeti. Yes, both doses taken, but lost the battle. Why?
I think probably none of us wants to take that question. It's so frustrating obviously for us as doctors, but for everybody, because we keep giving this message, vaccination. But you're absolutely right. There have been cases of people who get COVID despite the vaccination. So the first thing is that the vaccines are not perfect. Remember that in the trials, that depending, like the Covishield AstraZeneca vaccine was about 84% successful, which means that, and even that's in a trial. So in real life, that means maybe 1 out of 5 people who get the vaccine might still get COVID. Now, if you think in a country the size of India, okay, of course, India, now we have a lot of work to do to vaccinate more people, but we've still vaccinated already 10, 20, 30 million people. So once you have 20 million people vaccinated, 1/5 of those people will still get COVID, and regardless, that's a very big number. So the first thing I would say is that don't be surprised, although it's disheartening, but don't be very surprised when you hear somebody's gotten COVID after the vaccination, because it is possible, it is expected. It does not mean that the vaccines are false or a complete failure. They do work and they decrease the risk. Secondly, and most importantly, not only, even though vaccines prevent COVID only 80-90% of the time, depending on the vaccine, are very effective in preventing severe disease. So again, most people, if you do get COVID after vaccination, your disease is the infection is more mild than it would have been otherwise. And then finally, yes, you're absolutely right. There are a small number of people who, despite getting vaccinated, despite doing everything, unfortunately, a small number of those people will still lose the battle and still continue to have severe disease and get very sick and perhaps even die. And unfortunately, I don't know if Preeti or Khushbu wants to speak to that. I don't have an answer for that. I don't think we know why some individuals break through. We're worrying a lot now about, you must have heard in the news about the variants in India and in other countries, not only India, but some of these variants, sometimes the virus can learn to work around or escape the vaccination. Every information we have so far is that the vaccines, including Covishield and I believe Covaxin, the early data suggests that they are still quite effective against the new variants, but maybe increased failure. So I guess my answer is, it does happen. It's extremely sad and frustrating from a public health and a personal standpoint. We will continue. I know that so many people are continuing to try to improve the vaccines so that they respond better to individual variants. And the last message I would just have is that even if you hear about these rare breakthrough cases where people get sick despite the vaccine, the majority of us, all of us are better off getting the vaccine than not getting it. I think that's sort of the best response I can.
Thank you, Dr. Samar. Dr. Khushbu, would you like to add something to that, please?
I actually have nothing else to add. I think Summer did a very good job of putting all of this together. And just like he echoed, vaccines are not cures. They're essentially to prevent severe disease. They're there to help us not take the patients from their homes into the hospitals and put on ventilators and become my patients, essentially. So we're preventing them from coming and visiting me. And so I think that is the importance of it. There's always going to be a few patients, unfortunately, for whatever reason, who are not going to be, despite of this therapy, are going to move forward, but at least it won't be majority like what we're seeing at this time. I think that as we gain more information, remember this disease is very new. It has humbled the medical community. We are learning just as you guys are. And as we move forward, hopefully we will have more answers. But at this time, what we know is that we don't know why that is. The breakthroughs are happening.
Thank you so much, Dr. Khushbu.
Sorry, Professor, can I just add one comment? Anand Mittal said something very interesting in the chat, which is he said, and it was so perfect that I wanted to just say it out loud. He said, getting vaccinated is similar to wearing a seatbelt in the car. It may make you safer, but not invincible. So I actually want to change that a little bit, because getting a vaccine is not getting a seatbelt. Getting a vaccine is like driving carefully, because it not only protects you, but it protects everyone else too. So it's not only for you, it's for the whole community. Yes, even if you drive carefully, there is a chance you could still get an accident, but that doesn't mean we tell people don't drive carefully. So I very much like the analogy, but I would say the vaccine benefits everybody. But yes, we have to recognize that no safety measure we have right now is perfect. So I just like that comment.
Sure. Thank you so much, Dr. Samar. I think, that's a great analogy, that it's like you're driving, and if the numbers are like about 20% would be exposed, so that's a reality we have to kind of acknowledge and face too. Thank you so much. Kalpana, another question with you. I think you had Praveen.
Yeah, there are, in fact, Praveen had a very good question to ask, and after Praveen, there is one more person. Oh, first let Praveen ask. Sachin Agrawal wants to ask something. But first let Praveen ask the question. That was Praveen. Please unmute Praveen. Unmute yourself.
Unmute. You can hear me now?
Yeah.
Yeah. Good evening, all of you.
Good evening.
And good morning for the USA guys. I'll ask this question to Dr. Samar. Dr. Samar, discussing with the various doctors here, the root cause of the serious conditions and the fatalities which we are having, they said there are two causes, which is delay and denial. The two causes, they said. He said if you treat the flu or treat the symptoms in time, then you will surely save the serious conditions of the patients. And this is what doctors have been saying. I would like your comment on that. The delay and the denial. Not accepting that I'm having a fever, it is a COVID, running, waiting for the reports to come in, and delaying the things and denying yourself, I am fine. Maybe it is a flu. Maybe I've slept in an air conditioner. Maybe it is just a common cold or something like that. So this is what has caused the main fatalities and the serious condition of the patients. Your comments, please.
Yeah, Praveen, I think that's a very important point, and it's, and I agree that I think delay and denial is not something unique to India. I think that's something that
it is everywhere.
it is everywhere, and I think it's very something like a pandemic is and I think Kalpanaji was saying this earlier, that the pandemic has really affected everything about the way we think. I can give you one example from a hospital that I know, where very early in the pandemic, there was one nurse who had just runny nose, mild cough.
Yeah.
Oh, it's nothing, and they went to work, and then so many patients of that nurse got infected.
Yeah.
So I agree. I think that the reasons for the current situation in India are very complicated. I'm not going to try to, at this point, I'm not able to cast blame about what's happening, but I agree on a personal level. I don't think everybody should be terrified. I don't think that, anxiety itself can be very bad, but yes, this is something quite serious. And I think that it's the lockdowns and all have been very difficult for all of our friends and family. I know that. But yes, this is not the time to think maybe, to like, this is the time to be extra careful, especially if you have vulnerable family members, if you yourself,
Yeah.
like Preeti was saying, or Khushbu was saying, if you have diabetes or something, if you have some mild symptoms, if you're able to access a test, and if you're not able to access a test, always try to think you may be infected and wear a mask, protect yourself, protect your family.
Yeah, protect your family, the neighbor.
Be extra careful for your sake and everybody's sake. I know it's hard, but we have to get through this, and denying it has not until now, denying it has not solved anybody's problems.
Not solved anybody's problem. But usually they have been denying over here. Seen a lot of people denying.
Okay,
Thank you so
Doctor,
much.
Mr. Bhim Ratke, I was telling about Mr. Bhim Ratke. Sir, you please unmute yourself. He is one of our senior most members of our Alumni Association and one of our GEM in our Delhi chapter. He's just come back from his COVID and he wants to say something. Sir, please unmute yourself. Sir, please unmute yourself. Can you unmute, Abhinav?
No, Mama, actually, he has to do his.
Yeah, sir. Yes, sir.
No, I had both my shots, and 20 days after my second shot, I got COVID. It was mild, no doubt. My question is that after I've gone through COVID, what is the safety for me after COVID? I mean, can I transmit to others? Can I get transmitted from others?
Okay, so your question, sir, is that you had COVID and you recovered from that, and after that you got both your doses, right?
No, I got my doses before I got COVID.
I see, fair enough. Okay.
Preeti does infection control.
Sure. So first of all, Bhimji, I'm happy to hear that you've recovered well, and I'm sorry that this still happened to you after vaccination, particularly after both doses. But I think the exemplary story really of why we recommend vaccination, that it decreases not only death, but most importantly, severe disease and disease that will require prolonged hospitalization in an ICU setting. So the question that you're asking is one that I think many have wrestled with, but have come to fairly consistent guidance that is practiced almost universally. And that is, how do we appropriately isolate? When do we appropriately isolate? And how long do we appropriately isolate for? And I think there are a couple important points here. Basically, the tenets of how long we isolate for are based on whether or not we believe an individual can transmit virus. And that is measured by studies done in the laboratory to see how long virus can live and replicate and reproduce for. And so what has generally been found, and what is studied and is the reasoning for the recommendations that are now practiced universally, is that if an individual has mild or moderate disease, usually mild or even asymptomatic disease, they should isolate for 10 days. If they have severe disease and they require a prolonged ICU stay, then the requirement for isolation is 20 days. After those respective periods, 10 days and 20 days, there's no reason technically for that individual to isolate, because there's no more what we call replication competent virus, or virus that is able to be produced that we think is transmitted from individual to individual. Now, I will be the first to tell you that there are always exceptions, but that has been the general thinking for the programmatic public health measures that are in place for how long we isolate for. Typically, the thinking and where it gets even more murkier and where we have a lot to learn is, okay, so somebody has infection, these then have passed, 10, 20 days have passed. After 3 months, does that person still have immunity? It's hard to know. And that is why if an individual develops symptoms again, after say 3 or longer months from their original infection, we always recommend that they get tested And what the significance of that test is can sometimes be unclear. And that's why there's a lot of confusion. Hope that was helpful.
So what I want to say is that I got the second vaccine shot on the 8th of April. And I had no symptoms whatsoever, but my health, he got COVID, so I tested just for safety, to figure out if it's okay. And I got a positive result, and then there was a CT scan. My doctor ordered a CT scan. I got a level of 9 on that. It means a little more than mild, but lower end of moderate. I had no symptoms throughout, no fever at any stage throughout the period. Now it is, since it was tested, now it's 20 days are already over. And I want to travel, say, next week. So is it safe?
From the standpoint of no longer needing to isolate, yes, it's safe. I always recommend, though, when we travel, as to Summer's point, taking the example of the seat belt and driving carefully, that there's still an opportunity to mask, and that is to help protect others.
The thing is that I'm living alone here, and since I'm living alone, I want to travel to one of my family so that I can be taken care of. Because another month or so get recovery. So I want to travel by air.
We generally believe that it would be safe if it's been 20 days from the time that you've had disease to travel.
Yeah. Okay, thank you.
Thank you so much.
Sachin had a question.
May I please? Yeah, just a second. Guys, one of the responsibilities of kind of being moderator or something is to be mindful of the time. This is a brilliant conversation going, and we have so much ahead. I do understand. I think I asked Dr. Preeti. She said she had a hard stop almost at 1 hour, so maybe now she soon needs to go. But if I could ask Dr. Samar and Dr. Khushbu about how much more time you have, then we will work backwards to maximize, please. Dr. Mehrotra, and how much more minutes can you share with us, please?
I'm sure about 15 or 20 more minutes.
Awesome. Oh, that's brilliant. Dr. Samar?
Yeah, same.
Fantastic. And Dr. Khushbu?
Same.
Fantastic. Okay, so we have 15 more minutes. I think we'll get a lot of work done through. We are getting lots of questions on the chats. I'm seeing raised hands also from Nitin Gupta, Rotary and Rasik. I'm seeing from Sachin also, of course. And Dilpreet also has other questions with his bank. But anyway, let's proceed. So Kalpana, over to you. Quickly, any questions you may have, then we invite Dilpreet, and Dilpreet kind of coordinates a few more questions before we get into the closing. Please, Kalpana.
I think Sachin was very good.
Yes, ma'am.
And you please ask the question.
Thank you so much, ma'am.
And before Sachin answers the question, Sachin has been doing amazing work in Dehradun, for looking after the COVID patients along with our alumni association. Amazing work he has been doing. So he deserves a big, good applause. And Sachin, now you please ask a question, please. Ask.
Thank you so much, ma'am. Ma'am, just one question I wish to ask. That if there is a small child who is found positive, whether about 2 years, 3 years, or 5 years, who cannot segregate from his or her own mother. So what is the treatment protocol if the child is admitted to a hospital and where the child cannot stay apart from his mother? So, and if the mother is found COVID negative and whereas the child is found positive. So please could you guide what should be the treatment protocol or how to isolate that child?
So it's incredibly difficult. I sometimes think that isolation and small children can't really go in the same sentence because it's somewhat impossible. And so, care for the child, whether it's at home or care for the child at the hospital, is paramount. So, and much of that can be done and should be done with comfort and the safety of having their parents around. What I would say about parents who are involved in the care of their children is they are by definition going to be exposed. and are exposed if the child has tested positive, even if they themselves have tested negative. So to the extent that's possible, when interacting with the child, if they can, they should continue to wear a mask. That goes both at home and in the hospital setting or in the any healthcare setting. But you have to do what you have to do. Care of the child takes precedence. And then hand washing as well, hygiene in general is also equally effective and important. What I would say is the caretaker, whether it's mom or dad, should continue to monitor their own health and their own symptoms throughout that time. And what we generally think is, we know, and what's challenging about COVID is that the incubation period after one individual has been exposed can be fairly long. It can be up to 14 days. But it is typically within the first 5 days after an exposure that an individual starts to develop symptoms. So it's that short time frame within which, if a caretaker does develop symptoms, they themselves should actually get tested. But mask wearing, like I've said many times, is the single most important prevention measure in the absence of vaccination.
Thank you so much, Dr. Preeti. May I now invite our colleague Dilpreet. I believe Dilpreet also has a question, and Dilpreet, please feel free to go ahead with the question which you would have, or identify some guests whose questions have already come or who are already raising their hands, because you may know them. Please.
Sure. Thank you, sir. So there are a couple of questions that I've been seeing on chat, and those questions have come to us on personal chats as well. So pretty much, what Rasik is asking, Rasik Bhatia, Ramandeep is asking, and Dr. Shinde is asking. So I'll come to that question later, because I would like to summarize that question and put it in front of the panel for the answer, and so that everybody gets the answer to it. But before that, I have a very short and quick question. So, that also came on the chat, are the double mask, the cloth masks or double layer cloth masks actually helping in, stopping the spread of COVID, or, saving the patient or saving the person themselves who are wearing those double layer cloth masks?
What we know about masking, and there's been much controversy about it, is that with cloth masks, the more layers, the more cloth there is, the more protective it is. And that's why this idea of a double layer has come to fruition. Obviously, the most important thing is that you keep the mask on consistently and you wear it correctly. So whether it is single, double, triple, quadruple, the most important thing is that you keep it on, and you keep it both to cover your face and your nose at all times.
Wonderful. Thank you so much. So coming on to the next question, which primarily has been is coming very frequently now. The people, who have gone through the COVID, who have suffered COVID illness, have been put on steroids, have been put on blood thinners, or have taken, many medicines to come out of it. So when can those patients, call themselves safe? One. And second, and why I'm continuing this question is because, this would primarily step up to the last question that comes in, which is post-COVID care. What things which we should, keep in mind when we've already, gone through COVID, what in terms of our diet, in terms of our daily habits, or in terms of masking, or in terms of vaccinations, what should we do so that, stop ourselves from developing further symptoms which are, then being related to COVID only, like, kidney problems or heart problems or liver problems.
Thank you. Please.
So, Dilpreet, thank you for asking that question. I think that once you have, first of all, it would be a huge congratulations for you to have gotten over COVID in the first place, to where you feel that you are safe and that you're back home, or that your symptoms have subsided. So that's a great, that's amazing news. So you need to congratulate yourself. On the tail end, I will tell you that, COVID recovery, unlike recovery from other viral diseases that you might have had prior to COVID coming about, or bacterial infections that you might have had, pneumonias and things prior to COVID coming around, didn't take as long for you to recover. So you probably, and most people, and even we initially thought that patients should recover within the first 2 to 3 weeks and you should be back to your normal self. Well, we were very surprised in the least to see that that was not the case. A lot of the patients will experience a cough. which will continue to sort of, slow down over a period of time. You may notice the fatigue, which may also be there. And I think fatigue has lasted longer than cough in some instances. You will notice that even though you're recovering, your recovery is very slow. And that is not something that is abnormal in you or anyone else. That has just been the case for this specific disease. The way I would say it is if your disease was mild, your recovery will be faster. If your disease was moderate, you required oxygen, you needed to go to the hospital, your recovery is going to be just as slow. So there's nothing, you don't need to feel that your body is not responding. It is just taking some time to respond. Give yourself time to respond. What I mean by that is, don't look at it day by day. I would say look at it week by week and see, okay, am I doing better as compared to last week? If the answer is yes, you are progressively improving. That's how I would look at it. Okay. Pertaining to what you should be doing to help yourself, I think you should continue to be doing deep breathing exercises to keep your lungs open. You may experience cough when you do it, and that's okay. That is your lungs that were kind of collapsed or infected are opening up again. That is quite okay to have a cough. You can take over-the-counter cough medication, and that will help you eventually get over that. Fatigue, food is extremely important. There has not been a specific, superfood that has helped anyone, but in general, just eating a healthy diet. If you are a diabetic, be very mindful of keeping your blood glucose under control, very, very tight control. If you have high blood pressure, keeping that under control. Whatever disease that you might have that you are suffering from in the background, making sure that that is controlled so that it doesn't add to the problem or that it doesn't become a problem because of COVID. So that is extremely important. Continuing to wear a mask, even though you're recovering, you still want to continue to wear a mask. And making sure that when you are wearing a mask, that you are wearing a clean mask. So if you are sneezing and coughing in it, and if it starts to get wet, you need to change it to prevent yourself from getting other diseases that can happen, like fungal disinfection, for example. So you want to, clean your cloth mask. You want to wash it. You want to clean your, if you're using a disposable mask, you want to throw it away at the end of the day, or if it starts to get soiled. So those things are very important. Starting to do physical activity. I wouldn't say that you need to go run a marathon or you need to go run a mile outside, but I do encourage you to continue doing physical activity. Just because you were sick doesn't mean you need to remain sick. You need to start increasing your activity level. Just be mindful. If your body says I can't push any longer, then you stop. But you have to attempt it every single day. Okay. The things that I would be careful about are still monitoring periodically your oxygen levels, because COVID can sometimes cause blood clots. And the way you would discover the blood clots is you would notice that you were improving for a few weeks. And all of a sudden now you notice that you're getting more short of breath, you're getting swelling in your legs. I would directly go to your physician at that point. That is very important for you to do, to kind of be mindful. Things as they are improving, that's great. If you notice that you're going in a reverse for whatever reason, you definitely want to go and speak to your physician and make sure it's not something serious. Kidney disease has occurred in patients with COVID, but I've also seen patients recover from it. Now, if you had underlying kidney disease because of diabetes, because of high blood pressure, COVID is going to speed it up a bit more. So, you want to make sure you follow with your kidney doctors for that. Liver problems have the elevation in the liver function test is what we call it, where we kind of see liver problems. That occurs when they have taken certain medications when they were hospitalized, but they usually go away after a period of time. So I'm not seeing many patients, at least in my practice, that have suffered from liver disease as a consequence, unless of course they've developed clots. Now that is a different issue. And that can then unmask a lot of other things. So those, I think I kind of answered all of your questions. If there's something else, please let me know. I didn't answer.
Thank you so much, Dr. Samar. Your quick comments. We have about 6-7 minutes remaining. So probably this is the penultimate round. After this, we'll just have one round of wrap up, some questions. Dr. Samar still on this post-COVID and what Dilpreet's question was, sir.
No, I completely agree. I mean, Khushbu actually, as a pulmonologist, sees post-COVID patients much more frequently than I do, but that's certainly the same advice that I've been giving is that we've met people, at least because the early waves were more severe in US than in India. By now we're seeing people who are 4, 5, 6 months out from their infection. And I know I've had patients and colleagues and friends tell me that they have these symptoms, the little bit of a cough, maybe a little bit of chest tightness. I had a friend telling me that she felt foggy. They call it brain fog, that she couldn't concentrate properly for a few months afterwards. The good news, I think, is that a lot of these people do gradually get better. And I agree with Kush. As long as things like that week by week are improving, I think that's a good sign. If something new happens 3-4 weeks out, then you need to see a doctor because there are complications that can happen down the line. But if it's just gradual, slow recovery, I agree. I think, unfortunately, patience is probably and exercise and healthy eating are your best options.
Thank you so much, Dr. Samar. Dr. Preeti, your quick comments on this. Would you like to add anything?
I would echo Kushbu's and Samar's comments. What I would also say, in addition to tincture of time, is patience. Everybody's body responds differently. Everybody has a different trajectory with recovery. And while it might be tempting to say, my experience was this, and this person's experience was this, what we know very clearly is that everybody has a different experience. And so patience and time.
Thank you so much, Dr. Preeti. May I now invite my colleague Kalpana? We have another 3-4 minutes remaining. Kalpana, would there be any last minute question or something, or should we start the process of winding up?
Ruben, just one question. Can I ask one question?
Yes, sir, please.
Please.
Okay. Just, there's a lot of apprehension since we are talking about COVID in children. Now the mothers, parents, they're worried about their wards. Should a child get COVID? So would you in US subject them to some kind of steroid treatments or not? What is your recommendation on this? I could ask Dr. Preeti.
So for children, there's no clear role to give steroids preemptively or preventively in advance. The most important thing is prevention, and that's mask wearing. I can understand there being there is, anxiety, I think, is an understatement when there's COVID in a child in a household. And it's fair, and I think a true point epidemiologically, that we know transmission, when it happens mostly with the children, is happening within the household, either from an adult who might have had mild symptoms who's transmitted to a child, but we've also seen it in the other direction. And so I think there is a temptation to think about medications as part of prevention, but I would say steroids in particular, from the standpoint of giving them preemptively, can do much more harm than good.
My question starts once the child has contracted COVID.
Mm-hmm.
Thereafter, what kind of treatment protocol are you generally following in US?
Similar to adults, steroids generally are only recommended when there's moderate to severe disease, not for mild disease typically.
Okay, thank you very much. Thank you.
Thank you, Dr. Preeti. Thank you, Ajay. And I think Ajay, as the president of the Alumni Association, would be thanking our doctor colleagues also who joined. Ajay, may I take the liberty to convey your thanks on your behalf to our eminent panel that we had today?
Of course, that will be my pleasure, in fact, a privilege. Once again, I thank Dr. Khushbu and Dr. Samar, who was with us last time also. And I particularly thank Dr. Preeti for having joined us at a short notice. Let me tell you on behalf of each one of us, your talk has been very candid. All of you have come through very, very nicely. And I'm sure it's going to benefit each one of us in fighting the COVID as it unfolds here. So what we are only trying to do is exchange notes with you and be more careful, because you see in physicians, in parents, in people in general, there can be a lot of confusions. There's no standard protocol still. So the awareness will make all the difference. So this is the intended purpose of these town halls, and this is coming through very nicely. So on behalf of the SJ Alumni Association, I thank you very much for sparing that kind of time. And it has been wonderful, wonderful interacting with you. I also thank the Delhi chapter for having taken this initiative. And of course, Ravindra has been the anchor man for all this. So I thank the whole team for making it happen, and the doctors there for coming through so responsibly. Thank you very much. Thanks.
Thank you, Ajay. Thank you so much. May I invite now my colleague Kalpana Pandey, the president of the Delhi chapter of the SJ Association, along with our colleague Dilpreet Grover, who kind of helped us out. And there have been a lot of folks. It takes a team to put put a gathering together, man. Like Sachin Agarwal, you've seen Abhinav Goel, we see him sitting silently and being the techie in the background. A lot of other folks who helped us to make this all happen. May I invite now Kalpana to deliver the vote of thanks to the gathering, to the audiences, to the doctors. Kalpana, please.
Oh, thank you, Robin, and thank you, Ajay.
Thank you.
In fact, the first initial this thing was started from when this Dehradun chapter started at our parent organization. And, I just, I want to thank each one of the doctors, Dr. Samar, Dr. Khushbu, and Dr. Preeti, and each and every member who participated in it, and those who have really worked behind to help us out. But I have a small request to you doctors. I'll be in touch with Robin. We now, if this initiative could actually go down to the villages, especially in Uttarakhand, I've been trying to contact a lot of people, and very soon I think I'll be able to I'm trying basically, principal from schools or people of, parent bodies. So we can approach, and the children there, they've closed down the school, and a lot of, there are a lot of cases there, and they're not aware about things. Like here, I still feel we so much aware about things, we educated, but they are not there. So if we could help us out in there, but only if we could conduct maybe on a weekly basis. So I'm in touch with somebody in Almora, and Praveen has promised me somebody, and Randhir is somebody in Garhwal, and Dilpreet is at it. If you could help us out with that, it'll be so good. Thank you, and thank you everybody. Dilpreet, you'd like to say something?
Thank you so much, Ravinder sir. Thank you so much, Kalpana, Abhinav, Praveen sir, Ajay sir, Randhir sir, for giving the support to put this town hall together. I hope the audience that we had on board have really benefited from this session, and what the doctors, Samar Mehta, Preeti Malhotra, and Khushbu had to say. And because there is so much of there is a flurry of information these days on social media, and people get confused. So hearing from the doctors directly helps put a lot of confusions to at rest. And I really thank you for pulling out your time. And of course, like to what Kalpana said, yes, villages in India are now facing the heat of COVID. So this has penetrated there, and we've been in touch with a lot of people who are there in Uttarakhand or UP, villages where we have direct contacts, and we're trying to help them through providing a lot of consultations or medicines, or food, whatever help they kind of like really want. But of course, we are trying to gather our sources in providing them direct consultations of the doctors here in Delhi, and so that they can really benefit, and they really get the help and not get confused with what the other people have to say, or getting misdirected with the treatment. Thank you so much. Thank you everybody for joining us today. And I would like to wish you everybody a good night and a good morning to everybody in US. Thank you so much. It's a pleasure having you all. Thank you.
Thank you very much for having us. We appreciate it.
Bye-bye.
Thank you.
Thank
Bye.
you. Bye.
Thank you very much.
Everybody.
Thank you. God bless you, all of you.
Bye-bye.
Thank you, doctors. Thank you, panelists.
And we are absolutely happy to help you guys whenever you need us, for sure.
Thank you.